Perfect, thank you.
Not the black.
Well, thank you very much for staying on. It's the last thing in the day. Energy levels are probably flagging a bit. So I'm here to talk to you about the work of the Brazelton Centre, who are a charity based in Cambridge, and we deliver training throughout the UK. I've been struck today thinking about the Best Start plan and about how we hear the parent's voice in that and we hear the health professional's voice in that, but we don't necessarily hear the baby's voice in that. Unless we think about the preventative spend agenda, or if we think about why we are looking at keeping families and babies together and looking at continuity of care, because we're looking at maternal well-being, and in doing that we're looking at the baby's well-being because they exist in a relationship together. And I think that's what the Brazelton approach is about. It's about listening to the baby's voice, and it's about optimising that relationship between them. So, I was introduced, I'm a psychologist. I work in a child and adolescent mental health service in Lothian, in an outpatient team. And I suppose my personal interest in this is the preventative intervention that it is, in the hope that some of the work we do in these very early weeks and months and years prevents young people from coming to child and adolescent mental health services in their childhood and teenage years. That would be awesome. So this is just what we'll talk about today. It will be definitely a whistle-stop tour, so I'm sorry if I go a bit fast. The goal is about developing relationships, so it's the tools that the Brazelton Centre promote. They really look at how practitioners can develop their relationship with the parent, and there's quite a lot of outcome data from practitioners saying how much it enhances their relationship with families and parents. And it's about supporting baby brain development through that early relationship environment and understanding the baby's behaviour, their language through their behaviours. And as a psychologist, we call that mentalizing the baby, which is a weird thing to say, but it's basically the idea that we are trying to get a sense of this little person's mind from what he's showing us through his behaviours, through his cues and states. So these are different questions that I'm sure you've commonly been asked, and you were talking about the newborn examination, sometimes a time when lots of these types of questions come up. And I suppose we can answer these questions, or we could use a tool like the Brazelton approaches to actually explore these and show them to the parents. Look at the baby as a little person and see kind of where he's at with some of these things, or she. So we know that newborns do communicate. It's not news to any of us here. Sometimes psychology research is about stating the obvious or putting a lot of fancy research together to say what we've kind of known all along. Babies are very communicative. This is a little baby who is the daughter of a musician at only 6 hours old, and you can see the musicality in those hand movements. And the Brazelton approach draws on decades and decades of developmental research into newborn social communication. And it dates back to Dr. Berry Brazelton's early work in the 1950s and 60s. And that was a time when babies were really seen as a blank slate and that they weren't communicative and they weren't actually actively engaged in communication. It was thought that they were very passive. Any mum you spoke to at that time would probably have told you a very different story, but that's what the researchers said. So the Brazelton approach is built on looking at that expressiveness, that communicative intent that babies have, but also thinking about babies' behavioural states. And that was drawn in the work of Peter Wolf, who documented newborns' behavioural states in a huge amount of detail. And he concluded that all babies' behaviours, including their states, are inherently organised and responsive and reactive to the environment they're in and to their internal kind of environment, what's going on inside them and their physiological, the physiological demands that they're managing. So I don't know, is this kind of thing familiar to people here, the idea of baby states? Yeah? So we know that babies transition through all these different states, and using the Brazelton approach we can think about how easily babies transition between these different states and how much time they spend in the different states gives us a really good idea of how they're managing the world and their environment at that time, how stressful they find it and how much co-regulation they need from their parents and the people around them. So Dr Barry Brazelton, that's him, back in the day. He sadly passed away this year, just shy of his 100th birthday. He contributed this view of the baby as competent, organised. By that he just meant that what they do has a reason behind it. It's not random, it's not reflexive, it's organised with the view of communication with another person. So they're social, actively engaged, and each baby is individual with their unique set of dispositions and sensibilities. And that's really what the Brazelton approach and the tools that they've developed highlight for a parent. It's just what my baby can do and what a unique little person he or she is. So we know that all newborns are competent across all 5 modalities. They can visually track, they can locate sounds in their environment, habituate, so that's the basic process of learning. They can get used to things and block it out if it's not harmful. They can recognise mum's voice and smell, respond to touch, discriminate different emotional expressions, and they will turn their heads in preference, looking preferentially towards a face-like configuration of dots versus a random configuration of dots. So they're born primed for communication and primed for relationships with other people. So we know that babies can do all of these things from minutes, hours after birth. We know that all being well, they can attend, initiate and engage in interactions and using their eyes to maintain contact or to regulate themselves by little looks away if they need to kind of bring themselves together a bit. We know that they communicate very much through their crying, through their body movements. That's how they talk to us and tell us what they need. And we know that they respond to soothing, but we know that they can also self-soothe. So they have some capacities to manage themselves, and that's a massive individual difference that you'll see between different babies, is how well they can do that on their own and how much co-regulation they need from others. Oops. Right, so I'm just going to show you, I think if I press the green button, oh no, how do I get that to play?
Now, here I am again.
So this is Dr Joanna Arthur, the director of the Brazelton group. Having a little chat with Lucas, who's doing an hugely fantastic job of maintaining his head control, keeping his autonomic nervous system under control while he's in this weird position, and still maintaining eye contact and communicating using all these cues to communicate. And taking short breaks and looking away and letting Joanna know he's had enough, because he's kind of lost his postural tone and he's looking away now. So in the Brazelton approaches, we say what we see. So Joanna would be talking to Lucas, but she'd always also be talking about what he's doing and how he seems to be managing and giving him a voice in that way. I think I've already said this, that babies communicate all the time, but often it is very subtle. So when we're thinking about especially very little babies, we're often looking at their autonomic cues to give us an idea of what might be going on for them internally or how sensitive they might be in this moment. So we're looking at skin colour and kind of body tone, signs of that their autonomic system is really active or needing to be managed, like maybe hiccups or kind of regurgitating a bit, all those kind of autonomic signals. And each baby, through showing us these things, tells us who they are and how they're managing at the moment. So just a little bit of history. So Dr Barry Brazelton developed the Neonatal Behavioural Assessment Scale, which is really a neurodevelopmental assessment, and it has about 53 items, and it's quite a methodical, structured approach to looking at the newborn baby's individuality, but also kind of really looking at his regulatory capacities and how much support he needs. And then in 2007, Professor Nugent, who was a colleague of Dr Brazelton, he developed the Newborn Behavioural Observation, or the NBO as we call it. And he really designed that as a practitioner to be a relationship building tool. And he's based in America and he's a paediatrician, and I guess really interested in helping paediatricians, midwives, health professionals develop that relationship with the parent so that the parent can feel contained in their parenting of the baby. So the baby has some capacity for self-regulation, which will vary individually, but that's nested within the parent's capacity to co-regulate with the baby, and that's nested within the professional's containment of that relationship as well. And then we've got the idea of, your clinical supervision containing your containing of the relationship of the baby. So what do? We observe the baby along with the parent. We say what we're seeing, we're narrating to the parents what we're doing, actively listening to their contributions, to their questions, and involving the parent actively in the session. And it can be with a mum and dad, grandparents, siblings join in often as well. So everybody gets a chance to find out who this baby is. It's appropriate for any baby or family. We wouldn't tend to do the moving the baby around items with a very preterm baby, but once over 35 weeks, gestational age and medically stable, it's fine. But we often find in neonatal wards that health professionals are using the approach to support their understanding and to help parents notice and understand babies' cues as well. And it's been used across different types of populations. So I think the Bradson approach is really helpful in thinking of the first few months of life because it involves all these different transitions for the baby from the womb to the outside world, and thinking about that fourth trimester that we kind of refer to these days. Transition for the parents, becoming an adult, becoming a parent. And within the family as well, but also for practitioners, working with the family and baby, it provides so many teachable moments. And I think, when I think back to one of the first speakers today who developed the Baby Buddy app, she talked about the use of video and how important that is. And I think sometimes the Bradson approach allows us to do that live with the baby. So we can tell parents stuff, but it's probably not, and we can give them leaflets. But oftentimes it doesn't sink in, but showing and talking and seeing what the baby's contributing really does. And it supplements, health visitors use it a lot to supplement their talks about back to sleep and difficulties with sleeping and crying and feeding and all these things. All these conversations come up because you're observing the baby together. So some of the EMBO items we look at habituation to light and sound. So we're looking at the baby's ability to protect his sleep states in those items. So we're seeing how different babies might be more or less able to block out sound and light stimuli when they're in sleep states. We look at their muscle tone, different reflexes, and we also importantly look at how they respond to social cues, faces and voices, and also a ball and a rattle. We think about how distressed they might get in the observation and how much they need to be helped to console themselves in that co-regulation model. So this is another video. So this is from do I press this or do you press this? Okay. So here we're looking at this little baby, it's Lucas again. And we're looking at how he's staying in this bright alert state for.
And you found something to look at over there, Lucas?
And is able to follow this ball. I think he's about 3 weeks old here. And he follows both of his eyes and his face. But you can see he keeps that one hand up sometimes, which is a little bit of self-regulation. But he's interested in it, and he's working really hard to stay in that state so that he can stay attentive to it. And that's an incredibly hard little manoeuvre he's done there, looking all the way up the way to follow that ball.
Yeah.
And then we would do a similar thing with the rattle, but in the interest of time, sorry, I'm going to go on. So lots of research has been carried out with practitioners, asking them for feedback after they've had the training and started using it in practice, and it tells us a lot about their sense of more confidence and knowledge and skills working with babies and families in that relational way. That they particularly use the social interactive skills and they feel more confident talking about crying, consolability with parents. And importantly, I think they use the NBO a lot with fathers and mothers, and we know that the newborn period is a time for relationship breakdown, and I think that the NBO approach, using the baby as the focus, really helps fathers feel like they have a role that they sometimes find hard to transition into, I think. So parents, they feel they know their babies better, they're more confident, they feel trust in the practitioner who's carried it out, and that's really important for us as health professionals, and they feel closer to their babies. There's a lot of research from other countries as well. There are, oh gosh, I don't know how many studies looking at the NBAS, over 700, and a lot of studies looking at the NBO as well, but they consistently find these types of outcomes. Practitioners feel more confident, parent-infant engagement is rated as more optimal. There's some evidence about potential reductions in mothers' depressive and anxiety symptoms, increased levels of father involvement, and babies' improved attention and social skills. So in England, the Brazelton Centre delivers training all the time to hundreds of people. It's been recommended in these different policy documents, but also in Thameside and Glossop, they've developed a whole service system, an infant mental health approach that they call their early attachment service, where they've integrated the NBO and the NBAS into their service delivery model. So we train anybody, any health professional, health visitors, neonatal nurses, nursery nurses, midwives, OTs, physiotherapists, everybody. Importantly, we often get training requests for GPs as well, which I think is if you think of the checks that GPs do, they can be meaningful or they can be not so meaningful for parents, and using an NBAS approach could be make it a very meaningful experience. So finally, what do parents say after a Brazelton session with their baby? This is a long video, so I'll just show you a little bit of it.
Betty Hutchin helps these babies discover their world.
And she's very calm, and she's still following it, and she's going back this way again, and she's really interested, and she's following with her head, not just with her eyes. She does that, takes a little break again, and good girl. Look at that following.
Chloe.
Yeah.
The take-home lessons for parents like Chloe's new mum, Carolyn, are tremendous.
I think it's going to make me treat her with a little bit more respect almost. Like, she's got a lot going on in her mind, and I think you need to activate it and to get things moving and let her develop with it, because it's already there.
Going outside, darling, you put your little outfit on.
Okay. So the training courses that we provide, the NBAS, which is the more full-on comprehensive assessment, and in the NBO as well. And I'll let you read that because you have the slides, access to the slides afterwards as well. And that is it. So if anyone has any questions, I'll leave that last one up really. Oh, I can't go back. Thank you.
I think we have a roving mic, if anyone has any queries, questions. Any NBPN midwives here who might have a query? Because I'm always interested in the sleep states. I think that's really interesting. Aha. We have a question.
It would be interesting talking about sleep states with women antenatally as well, because obviously the fetus has sleep states too. We know that they spend a lot of time in active sleep.
Do you provide the training here in NHS Lothian?
The training is usually coordinated by managers approaching the Brazelton Centre, and then they organise trainings for groups of up to 20 people. So the centre is a charity, and they rely on their funding from the training that they deliver, as well as donations and fundraising. So we haven't done a huge amount of training in Scotland actually, despite it being hugely popular in England, and I've always been a bit confused why. So there's myself, I can go out and deliver training, but it's usually coordinated by the Brazelton Centre.
I suppose, if I could ask the NBPN, Examination Newborn Midwives, is the Brazelton included within the programme? Sorry.
Not that I've been particularly conscious of, sort of using as such.
Yeah, that would be such an amazing opportunity.
Because I'm conscious many of the courses, certainly in England, have a Brazelton thread
Yeah.
And I think that
Yeah.
comes from the
I
initial
think every time you
design.
see something that talks about baby states or talks about picking up on baby cues,
Yeah.
you're drawing on the
Yes,
Brazelton
yes.
research. Really.
Yeah,
So
yeah,
in the
that'd be
Baby
good.
Buddy app as well, I think they've got a few videos that are directly influenced by the Brazelton work.
Fab, thank you. Anybody ever have a question? You're totally, is your brain's all full? Is that what it is?
Well to hang on
The
to,
brains
I
are
think.
full. Well, thank you again
Thank you
for
so
your
much.
session. It was really interesting. I'm literally going to say 2 words now, probably. Oh, have you stolen